Welcome, everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 138,010 confirmed cases of COVID-19 in Canada and 44,504 cases in Ontario. Chatham-Kent has 366 cases and Sarnia-Lambton has reported 343 cases. Michigan now has 112,612 cases, with 14,049 cases being in Detroit. Today, we are reporting 2,599 cases of COVID-19, an increase of 5 new cases from yesterday. 3 are residents of a retirement home, 1 is related to international travel, and 1 is a close contact of a confirmed case. 2,437 cases are now resolved, and 86 cases are active and being followed by our health unit. 1 person is in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 3 retirement homes currently experiencing a COVID-19 outbreak. Our public health inspectors and tobacco and vaping enforcement officers continue to conduct compliance checks and follow up on complaints related to COVID issues. So far, for the month of September, they have followed up on 296 complaints, including requests for inspections, investigations, and education. This includes work related to outbreaks, workplace clusters, and infection control audits. Infection measures and COVID education is included in all routine inspections now. Any non-compliance is posted on our website on our disclosure site. So for example, if screening signage is not posted on entry into a restaurant, you'll see that on our disclosure site. We have issued a total of 8 notices of violation to establishments, all related to the face covering order. Some of the concerns brought forward to our health unit are people not wearing masks, not wearing them properly or at all, crowded patio areas, people not physically distancing, and reports of people not following their quarantine order or isolation order. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Please check our website for information for parents and caregivers as children return to school. We have guidance for both elementary and high school students, including a quick symptom check to help you determine if your child should remain home due to illness. To access an assessment and testing center, there are several options in Windsor-Essex County. Erie Shores Healthcare in Leamington, Windsor Regional Hospital Olette Campus, the Sportsplex at St. Clair College, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or the healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to check our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thanks for joining us again. Yesterday, the province of Ontario reported the highest number of daily cases since June of this year. This case count jumped to 313 cases, with 3 health units accounting for 80% of these cases. This is concerning not only to those 3 regions, but also a reminder to other regions that if we don't take actions now, it can get worse. The cases in the community do not increase one by one. It increases exponentially. And we may not get a chance to act before it is too late. Just to give you an example of the exponential growth phenomena, we are reporting 5 cases today, and let's say that these individuals did not follow any public health measures, and assuming that each of them infect 2 additional people. This will result in 10 new cases, and if each of these 10 new cases infect 2 more people, they will infect 20 more people. Then these 20 people will infect 40 more people, and then 80, and then 160, 320, 640 more people. You can easily do the rest of the math and understand why it's so easy to be in a situation which we have avoided, and we worked really hard to move our entire region forward. And if some of these people think that we should only care about the hospitalization rate, and let's just do the maths again for hospitalization. So we're talking about 10% hospitalization. It means that out of these 640 people that we talked about, that means 64 people will require hospitalization. And if we go with the 3% mortality of all these cases, that means at least 20 people will die. I want to ask, do we truly understand the impact of the spread? Another example, an indoor gathering of 50 people with 1 positive case that can infect, based on the numbers that we have seen, between 20 to 30% of the people. Meaning we now have 10 to 15 new cases. Even conservatively, 10 new cases, if goes unchecked, can result in many additional cases in quick cycles. And let's say that there are 10 similar gatherings happening across the region same day, you can easily have 100 to 150 cases in just a few days with these 10 gatherings. Are we willing to risk it all and become so insensitive that we want to talk only about ourselves, or want to talk only about hospitalization, or we want to only talk about death? Are we willing to care only when our lives are personally affected by seeing anyone sick with COVID, or hospitalized with COVID, or worse, die with COVID? I truly believe that no one wants to see the cases rise in our community. No one wants to see our hospital beds occupied with COVID cases. No one wants to see surgeries and other non-urgent hospital care postponed. No one wants to see people in ICU beds with COVID and require ventilator beds. No one wants to see our economy rolling back. No one wants to see businesses shutting down. We need to act now to prevent all that from happening. Public health measures are in place to protect the spread of COVID-19 and save life. While it is critically important to have these measures in place to protect everyone, reduce hospitalization and save life, it is also important for us to think about our mental, social, and economic well-being. We are in stage 3 of the reopening that allowed us to take charge of our mental, social, and economic well-being. But we can only do it when we are willing to see what is at stake. I want to request all the residents of Windsor-Essex to do their part, understand how the disease is spread, take actions to protect ourselves and not to contract the disease in the first place, and unfortunately, if you contract it, do your best to prevent it from spreading to other individuals. I want to request all the businesses to take actions and do their part, review their plan, ensure that they're keeping their employees safe, including keeping their patrons safe. I want to request all parents to take actions and ensure that they are doing the health assessment on their children, keeping them at home if they have any symptoms. They should talk to their children every day after school to understand what they're going through, how they're doing in this pandemic times, how they're keeping themselves safe. I want to request all our agri-farm sector to be vigilant, to implement everything that we have asked them to implement. Keep their workers safe, keep their workplace safe. Lastly, I want to talk about the class action order for face covering. We have updated our class action order for face covering to include public libraries across Windsor-Essex County. The class action order will be updated on our website today, and the expectation is that the libraries across the region will implement this order starting Monday next week. Thank you.
We'll now take questions from the media. We'll start with Windsorite.
None at the moment, thanks.
Any questions from CBC?
No, thank you.
Any questions from AM 800?
I have a couple for Teresa and a couple for Dr. Ahmed. Dr. Ahmed, why just public libraries?
We recognize that Windsor Public Library has implemented the mask policy, and the rest of the libraries in the region have varying degrees of policy. Some municipalities have ordered mask policy across the municipality. Some included libraries, some didn't include library, recognizing that the county, that these libraries, the Essex County libraries, are operated by the county and not individually municipality. And so it's a facility that is operated in a municipal land, but operated by an entity which is the county. And having this different jurisdiction creates more challenges. So as a result, to ensure that everything is covered, all the libraries are covered, we have included libraries in the class action order. So all the libraries will be expected to implement all these policies across the region consistently without any confusion.
When it comes to the order, do face coverings, do individuals have to wear them for places of worship? Have you looked at other bylaws around our area? Are they all the same, or do different municipalities have different bylaws for places of worship?
To my understanding, almost all of the municipalities do not include face covering for religious places or places of worship, but many of the places of worship themselves have included them as part of there. So we recognize and we recommend that people should use face coverings in all areas where physical distancing is not possible. There are some areas that are of a higher risk, so we definitely want people to follow that and encourage the municipalities to cover it under their bylaw or if under our Section 22 order. But many of these places of worship, they themselves have voluntarily implemented many of these policies, which is a good thing, and recognizing that they should take control. They should be empowered to make all those decisions, and most of these places are following those recommendations. So it's a good thing, and I'm glad that they are doing all of that to protect their worshippers.
I have a question for Teresa. Do you want me to ask it now or the follow-ups?
Sure, go ahead.
Teresa, just in regards to those 8 notices, I asked this question, kind of a similar question a couple weeks ago when you gave us the previous update. What are your enforcement officers hearing from these businesses? Why aren't they following this simple mask order? It's not that difficult.
So the tobacco and vaping enforcement officers will go out and as we've talked about it before, they'll provide the education. So if they see repeated offenses and that they're not adhering to the education for whatever reason, I'm not really sure. I didn't kind of dive into the specifics of rationale, but if they're not in compliance with the masking order, they will return and do further checks to see if their education has been adhered to. And if not, then this notice of violation is the next step in the progressive enforcement. And they'll have to proceed with charges if that doesn't help with the situation. But I'm not really sure. People have their own reasons for compliance and non-compliance, but our enforcement officers are very clear about what is required and will continue to follow up.
Are these 8 establishments new establishments, or are they included in the 4 you previously stated?
So the 8 include 4, the previous 4, so 8 establishments in all.
Okay, thank you.
Any questions from Blackburn?
Yes, Dr. Ahmed, I wanted to ask you if you've been in conversations with Health Minister Elliott about her fall plan that she's been working on all summer, and if so, what have you told her?
So we have been in contact with the office of Minister Elliott specifically for one request that we received yesterday about the community cluster and how we handled it. We typically are in contact with the Deputy Minister's office, with the Chief Medical Officers of Health office to talk more about the planning and overall what's going on regionally, as well as our our role as the medical officers of health in the province of Ontario to provide some of those recommendations and to the province. So there are a number of planning that are happening everywhere at the provincial level, at the local level. And the Windsor-Essex County Health Unit has been part of many of those conversations, whether we are talking about the planning for the long-term care home, whether we are talking about planning for any of these public health measures, initiatives, regionally, locally, or provincially. So we've been in contact with many different people, but mainly from the Office of the Chief Medical Officer of Health, and also with for specific conversation with the different levels of government as well.
And I guess, what would you say is the likelihood right now that we're going to see a second wave and possibly a second lockdown? I know that, we have 5 cases today. We had 11 yesterday, but across the province we had, as you know, 313, and in places where the pandemic kind of got rolling in this province too.
Well, I think given how we have seen how the pandemic progresses, there's always a first wave and then there's a second wave, unless we contain the first wave up to the level by eliminating the disease, which happens very rarely. So in many of these pandemic, when there is a transmission or there is a novel virus, which the body do not have any immunity, and we do not have any way to contain the virus either through vaccination or treatment in the timely manner. And the long incubation period and the mild severity of the disease or the mild illness makes it all challenging for the early disease containment. So in all of these situations, what happens is we see a cycle. We see a surge in the number of cases where people recognize that, yes, they have the disease, and then we need to take more aggressive action to contain it. And then by the time we contain the disease, life has to go back to normal. We have to go back to some of the economic recovery piece. We have to go back to some of the mental and social well-being pieces. And when we start to see it, almost fascinating to see the human behavior, they forget everything what happened, how much work that we have done to get there. And then they just want to go back to normal. And in most cases, things are not normal. COVID-19 still exists in our community. Back in March, we didn't had any case, and we were talking about everyone was so concerned, everyone was so scared of contracting COVID. Now we are reporting daily cases in our community, sometimes 5, sometimes maybe a little more than 10. And all of those are indicator that it exists in our community. So it is within here, and the second wave, if people are not taking precaution, it can be worse. 1918 flu pandemic. The second wave resulted in millions of deaths just because people just think that, oh, it's over. They came out and they celebrated in big time. Some of these social gatherings that we are seeing, it's almost pointing similar fact that people are celebrating that, oh yeah, we're done, let's just enjoy, and then we're in stage 3 or we're moving forward. It's not. So I think what even today's message is, we can get worse. And what most people cannot see, that how much we are preventing. It's very difficult to quantify how much we are preventing. So I just gave you some extrapolation of the numbers, that how easily just even these 5 cases can result in hundreds and hundreds of cases. And if even with the numbers that we are going, how many people will end up hospitalization? How many people will end up dying? So I think it's very important for us to be mindful. Second wave will come. The question is, how are we taking control of our fate? How are we acting to see the impact of second wave? And now is the time. If we act now, we can have a much controlled second wave, where we can protect many lives. We can protect our economic well-being. We can protect our community. As I mentioned, no one wants to see us rolling back to where we were in stage 1 or back in June or May with very minimal economic activities. No one wants that. So I think it is up to us. It is all of us that we have to act and save us from going into that similar situation and keep us in the same phase and continue to do the good work.
Just to clarify, are you seeing that pattern of behavior that we have seen historically in pandemics? You pointed to the 1918 flu pandemic and how people came out and celebrated. Is that what you're seeing in the community now?
Well, the general impression is like that because so the number of what we have seen today, 313, if we go back with when they possibly acquired the virus, it was probably the Labor Day weekend. And then now they're all showing up with all these number of like positive cases with symptoms. So it is pointing that something happened during that timeline. And as we have done in the past, myself included, previous years, that before we end our, we call this, the summer is over, before Labor Day, we celebrate, we go out, we have parties, and just to say, oh yeah, you know what, this is the last party of the season, and then we'll all be busy, children will go back to school. My guess is similar things happened, and that's what it's led to all of these numbers. So it may not necessarily be that grand celebration that happened in 1918, but somewhat similar. People are thinking that yes, maybe it's time, we can still make those connections, we can still meet with many people, indoor gathering of 50, and I think that's confusing for people, and we talked about it. Indoor gathering of 50, it's not the same as 10 people in their social bubble. It's very, very different. We need to think about maybe anyone who's outside of our household. What do we do to protect ourselves from them? Because potentially any of them could be a case. And I know people don't want to hear that. People don't want to follow some of those recommendations because we've been doing that for long. But we have to remember what is at stake. So just think about it. What is at stake? For many businesses or some of those individuals, maybe they think that their business, their work, their social life was never impacted by COVID, but please talk to those who lost their businesses, people who lost their lives to COVID, their loved ones to COVID, people who lost their jobs. So I think we need to not ignore all of those things, and we need to think what is at stake, and we need to think rationally. We like to maintain many of these mental and social well-being of ourselves by having those some of those events. How do you do it safely? I think that's the critical piece, because if we cannot do it safely, then maybe we have to think, should we just shut it down? Should we just think about, okay, maybe focus on the economic priority and economic work, and maybe reduce or eliminate all these social gatherings altogether? So I think all those things, we don't want to be in that situation to think about it. And it's time that everyone take some action, take it seriously, because once it starts to spread, it would be very difficult to contain. Don't think that the numbers that we are having right now, it's a good sign that we will never get there. We can easily multiply and number go to a level which would make it very difficult for every one of us. So it's a good reminder. Please take action right now.
Thank you very much.
Any questions from the Windsor Star?
Yes, good morning, Doctor. I know you mentioned yesterday that your team is still working to see if new cases belong to a second cluster, but I'm just wondering if you have seen the new close contacts coming out. Are they related to social gathering?
Yes, we have some preliminary information that they are related to at least a few gatherings that resulted in that cluster, and we hope to share that information, more details, try to put all together in a similar contact tree and put a story to it probably on Thursday. And that will be the day when we'll share the most up-to-date summary of the cluster and all the details that we can share publicly.
Okay, and then separately, the international travel-related case might be for Teresa, but is that a person who is an agricultural farm worker arriving in Canada, like previously reported?
Not that I'm aware of. It's traveled outside of North America, but I don't believe it's an agri-farm worker.
Okay, thank you.
Any questions from Windsorite?
Dr. Ahmed, looking ahead to flu season, Do you recommend more than ever that people get the flu shot this year? And are you hopeful that maybe mandatory masking will actually cut down on flu transmission this year?
Well, again, when we are talking about many of these public health measures or control, we see all of these measures as additive to each other. I recommend every year people should get their flu shot. So this year, definitely, it's even more important for people who may be on the fence for not getting the flu shot. It just basically saves people and prevent any transmission. And so if people are have the influenza vaccine, and if they're not contracting influenza, they're reducing their number of time they have to go to the hospital or to the doctor's office. We know there are a number of seniors who end up hospitalization and even worse, die from flu. So we will reduce all of those unnecessary hospitalization, which can put an individual not only for developing risks, complication associated with influenza, but also can put them at a risk of contracting COVID. So at least do the prevention what you can based on the tools that you have, which includes not only the public health measures, but also the influenza vaccine. So as soon as it becomes available, I would strongly request everyone in our community to get their flu shot, to get one thing out of the way, and then just continue to focus on everything else and continue to stay safe, healthy, and keep our community safe.
Okay, thank you.
Any questions from CBC?
All good, thanks.
Any additional questions from AIM 800?
Sorry, just one, Dr. Ahmed, just going off of Taylor's question. Are you saying we have a second cluster and you'll be sharing more details about it Thursday?
Yeah, we do have, I think what we have numbers we put together, we feel strongly that they're all, we can classify them as cluster now. So we'll share all those details on Thursday.
Okay, thank you.
Any additional questions from Blackburn?
I'm all good, thank you.
Any additional questions from Windsor Star?
No, thank you.
Okay, thank you, everyone.
Thank you.